Hey guys, in this video we will discuss about lesions in the cerebellum. So we will demonstrate a few signs so that you can get an idea. So my name is Dr. Aman Setiya. So first of all, before performing any examination in patient, we should always welcome our patient. So good afternoon, my name is Dr. Aman Setiya. So I will like to do few examination on you. Are you comfortable in that?
Yes, sir.
So after taking consent from the patient, we should do some examination. So cerebellum, remember, this is an important organ of the brain. So which have mainly two primary function. The first is this will maintain your balance and posture, and second, this will control your voluntary activities. So in order to understand whenever a person is having lesion in the cerebellum, we have to know about few points. So starting with the first one, first is we should see any sort of ataxia in the patient. So to see this ataxia, what we are doing, we will tell the patient to stand by closing his feet together, and then we will see any type of swaying movement. A normal person normally can stand normally without any swaying movement. So can you please stand on your feet?
Yes, sir.
Can you please close your feet closer? So you can clearly see a person, normal person, when there is no involvement of cerebellum, he can clearly stand without any swaying movement. So make sure you are not performing a Romberg test, because a Romberg test is more of a test that is for sensory ataxia, not for cerebellar lesion. So this is about the first thing, that is we are checking for ataxia on standing. So the next test what we are doing, we are checking the patient ability to move in a straight line. That is called a tandem walking. So this will be the second test after ataxia, tandem walking. So would you like to help me? I want you to move on this line, on this straight line.
Yes, sir.
So can you move on this straight line by using your heels and toes? So whenever a person is having no cerebral involvement, you can see normal person, he can clearly move without any swaying. So he can move with his heels and toe. But if a person, contrary to this, if you see if a person who is having a cerebellar lesion, so suppose we don't have a patient here, so I will tell you, like a person who is having cerebellar lesion, he can't move on this straight line because he will have a swaying movement or he may fall. So this is, he cannot move in this straight line. About this is what we call tandem walking. So third test that we see here, we will see the speech of the patient. So whenever a person who is having cerebellar lesion, you will see there will be dysarthria. So his speech will be a slow or slurry speech. So this is basically a slow fragmented speech. We also use the term like dysarthria of staccato, right? So these are a few terms. So there will be a problem in the larynx or tongue. So patient cannot speak properly. There will be fragmented speech. So now let us check this. Can you say nursing next live?
Yes, sir. Nursing next live.
So now you can see there is no fragmentation. If any person who is having cerebellar lesion, the speech will be slow slurry, like he will say nursing next live like this, nursing next live. So that is called slow fragmented speech. So this is what we see in a patient of cerebellum lesion. So fourth test, we will assess the patient whether he is having any sort of nystagmus or not. So I want you to focus on my finger. Don't tilt or rotate your neck. Just through your eyes, try to see where my finger goes. Right. First, what I am doing, I am taking my finger to right side or left side, and I am noticing any sort of nystagmus in the patient. So I have rotated the finger. You can see there is no nystagmus here. So in patient with cerebellar lesion, you will see a horizontal nystagmus towards the side of lesion. So that is what we see. Nystagmus is important feature of cerebellar lesion. Fifth thing that we check in patient is we check the tone of the patient. So although this you will see in cerebellar lesion, we can see patient will have hypotonia, but it is not a specific sign. because hypotonia is a feature of many neurological condition or any involvement of a lower motor neuron lesion. So hypotonia we see in cerebellar lesion as well. So this is the fifth feature, hypotonia. So sixth sign of cerebellar lesion is we will check for any intentional tremors in the patient. So intentional tremors means patient will have tremors while or at the end of his achieving his goal. So you can see, I will ask the patient, can you slowly try to hold this bottle?
Yes, sir.
So this is like a normal person. You can see he can clearly hold the bottle. If you see any person with a cerebellar lesion, suppose if I show you a person who is having cerebellar lesion, they will develop, he or she will develop tremors towards the target whenever he is trying to achieve his target. So here I am trying to get my goal. You can see the tremors in my hand. This is what we say intentional tremors that we see in a patient with cerebellar lesion. So next feature or next clinical sign that we see, we call this dysmetria and dysenergia. So dysenergia is basically something like patient can't perform a complex task movement, and in dysmetria, like we check this. So patient cannot arrest his movement. So that how we can check. We can check this by finger nose test. So let me first explain the patient how to do this test. What you have to do, you have to take your finger out and touch this to your nose and try to do this in a faster speed. Can you do this fast for me like this? So this you can see, patient can do this test. This test what we call finger nose test. Finger nose test. Sometime if a person who is having cerebellar lesion, then you can see this finger nose test, either he will perform this very slow, or sometime his finger will be short. We call this hypometria. This is like short, or sometimes this will overshoot. This will go more. Like suppose now you can see a patient with cerebral lesion, how he will perform this test like. So this is called finger nose test. So he is not properly touching, either this is left less or it is going far. This is called finger nose test or past pointing. The second more complex version of this is called finger to finger nose test. Finger to finger nose test. In this what I will do is, I will try to rotate my finger in different direction and tell the patient to keep on touching my finger, then touch his nose. So what I will do is, you have to touch my finger, then after this every time you have to touch your nose, and I will try to rotate my finger. Touch it. So this is like a more complex test where we can also simultaneously check a dysenergia. So here we are checking for both dysmetria as well as dysenergia. We call this finger to finger nose test. Next test that we test is called Diardo Kyia. In this Diardo Kyia, what we'll do is, we will try the patient to do some rapid tap movement. So either he can tap on his thighs, or he can do a rapid tap movement like this, to and fro movement. So we can see how a patient can perform. Later on I will tell you how a patient with cerebellar lesion is performing this movement. So what you have to do, you have to tap like this, the palmar surface, dorsal surface. So you have to tap like this. Do this. So you can see the person can move this, so there is no cerebral involvement. Now I will tell you, if a person who is having cerebellar lesion, how he will do this. He can do this, then he may miss, or he will do this slow. This is what we call this. We call this Diardo Kyia. So next test is what we say rebound phenomena. So in this, what first we do is we apply our left hand as a guard and explain the patient like, you have to apply a force against resistance on my hand. So can you do this? Try to pull your hand on your side, and I will try to pull this on my side, right? And without explaining to patient, suddenly what I'll do, I have to withdraw my hand. But make sure while doing this, patient can hit with his hand on his face. So what we are doing, I am using my left hand as a guard. So let us see. So you can see this is like a patient can stop. he can stop, but a patient with cerebellar lesion, he or she will hit his or her face. We call this rebound phenomenon. Next test what we do is, for this we need a knee hammer. So with this knee hammer I will strike on the patellar tendon. So normally what we do, we check for knee jerk. So in normal person, what you see, you can see 1, 2, 3 rhythmic oscillatory movement. So let me try to tell you what we call this. We call this knee jerk. So I am striking the patellar tendon, and you can see there is a little movement. Let's see once again. So you can see it stopped after 2 movements. Let's see once again. So this is, you can see it's 1, 2 or 3, maximum 3 movements. After that, it will stop. In a person who is having a cerebellar lesion, you will see more than 4 oscillatory movement. This is what we call this pendular knee jerk. So unfortunately we don't have a patient, so I will tell you how this pendulum knee jerk will look like. Can you please come here? Yeah. So suppose if strike with this knee hammer on my leg, on my knee, then you can see, if you see this 1, 2, 3, 4 or more, see once again, 1, 2, 3, 4. If you see more than 4 oscillatory movement, this is what we call pendular knee jerk, means it is moving like a pendulum. So now this test is what we call this heel shin test. In this test, first we will explain the patient with one leg. He have to touch the heel of his foot to the knee, then go downward along the shin, along the tibia. So can you touch your heel of right leg to the knee, then slowly go down along this part. Can you touch this leg, heel to this knee?
Yes, sir.
And can you go down? So you can see a normal person, he can perform this test. Can you do the same with other leg? So this you can see, we call this patient who is not having cerebellum involvement, he can easily do this. So this is about heel shin test. So remember, demonstration is a better way of learning. So that is why what I thought to discuss about these signs of cerebellum. See you in the next video with some more knowledge. Keep working hard, keep shining. Remember, you can, you will. See you in some other video. Bye bye. Take care.